Good afternoon. This is Dr. Tim. I am talking to you today about what is referred to as SI joint pain or sacroiliac dysfunction. This is one of the most common things that I see in my practice. And I have been practicing chiropractic work for 15 years. One of the things that I've seen a lot of people go through is trying to use painkillers and muscle relaxants or physical therapy to relieve their sacroiliac dysfunction, which generally causes pain in the low back. Now, for most, if that joint does not become more stable, then the chasing of pain relief can go on and sometimes be never ending. So, as a 15-year chiropractic practitioner, I would recommend, if you're having low back pain, it's best to first start with getting checked by a chiropractor. Not all chiropractors perform the same techniques to address this. So it will be really important for you to call an office that you have chosen and ask questions. One of the first questions I would ask is, do you strictly use manipulative therapies? Or do you use instrumentation to assist in your adjusting? These questions will give you an idea of whether this is going to be a very manual physical experience, which some do not tolerate well, or if it'll be a more gentle, focused approach using instrumentation. There are other techniques that require special equipment, such as drop table, side posturing technique, but it's most important that you ask these qualifying questions before going to see a chiropractor so that you can have an expectation of your experience. Once you have found a chiropractor and they've answered this question for you, you should really go online and use YouTube University and find that technique online and see what it looks like. You may find that it looks exactly like what you would appreciate and handle having done to you, or you may find that, whoa, that looks like it's a little bit aggressive for me, and then you can choose a different chiropractic office. Please don't expect the chiropractor you are going to see change their technique because of what your needs are. Chiropractic work is very specific, and we choose the techniques that we are most proficient at. Even though we are taught a lot of varying techniques, you want to use a chiropractor that is focused on one specific technique so that you know the competency is going to be there. So with that said, if you feel like your low back pain could be associated with your sacroiliac joint, which can either be on the left or right side, this pain can radiate all the way across your low back. Start looking up a chiropractic office. Get a handful of treatments and see where things are. If you find that it's overwhelming because the chiropractor wants to charge you several $1,000s, put you on a 4 times a week care plan for 6 to 12 weeks, that's a little bit much to start off with. Take it slow, take it easy, but also listen to the recommendations. And if it feels right to you, then go with it. If it doesn't feel right to you, move on and find another practitioner. With that said, I wish you the very best day, and in your health, you will find happiness.